It's May of 2024. We now have 2 FDA-approved products for the treatment of geographic atrophy, or GA. I'm Deepak Sambhara, partner and retina specialist at the Eye Clinic of Wisconsin. Let's just get right into it. GA is an advanced finding in dry macular degeneration caused by progressive loss of photoreceptors and retina pigment epithelium. It's thought to be mediated by oxidative stress and inflammation. As such, there have been several therapeutic targets over the years looking at treatments for GA, the most common of which being part of our immune system called the complement cascade, which has been thought to be overactivated in folks who are at risk of developing GA. So let's talk real high level about this extremely intricate part of our immune system to get a better understanding of how these drugs work. Broadly speaking, our immune system can be broken down into 2 parts. We have adaptive immunity and innate immunity. Think of our adaptive immune system kind of like the FBI running plates. It's SEAL Team 6, the Special Ops. It's a very specific response to a very specific bad guy. Versus our innate immune system is the more evolutionarily rudimentary part of our immune system. It's the security alarm to our house, the 911 dispatcher who picks up the phone. The most obvious example of our innate immune system is our skin. It's a physical barrier that keeps the bad guys out. In our systemic circulation, we have different protein and molecular effectors whose main purpose is to drum up inflammation to get rid of the bad guys, and that's exactly where our complement cascade and system belongs. So an overactivation of this highly pro-inflammatory system has been both directly and indirectly implicated in the pathogenesis of GA. So if you could modulate the activation of this inflammatory system, you could potentially slow down the rate of progression of GA, and that's exactly how these drugs work. Stay tuned to part 2 of this video where we can talk about some practical considerations when discussing GA with patients.